Hello, my name is Jay-Sheree Allen, and I am a 2018 graduate of Mayo Clinic's Family Medicine Residency program. And so my current practice is currently in a rural setting. I am a National Health Service Corps scholar, and I wanted to work actually in an urban, underserved environment upon graduating from residency. But my experience at Kasson really broadened my horizons and really opened me up to the world of rural, or maybe semi-rural medicine. I actually came to Mayo as a fourth year medical student on a visiting rotation. And I absolutely loved the program. I had to take stock and I said, if I could do this much and learn this much in 4 weeks, I think I spent 2 weeks out at Kasson. I spent a week in the hospital. I did a night of overnight call with, I forgot who the resident was at that time. I worked in the nursery Methodist hospital. I got to, so many things. And I said, if I could do this in 4 weeks, oh my God, what could I do in 3 years coming to this program? And I do not regret it one bit. And I think this program has not only lived up to the expectations that I came with, but surpassed them, to be perfectly honest. So I loved being a part of a larger academic community. I really appreciated the resources that Mayo had to offer to my training. I have a strong interest in global health. And so I was able to travel to Ghana and work with the Korlebu Teaching Hospital. They have a family medicine residency program attached to their polyclinic. And so that was incredible to spend a month working there, so just those other programs that are available through the larger Mayo system, not necessarily just restricted to family medicine, that really attracted me to Mayo for sure. I love the resident run clinic. I thought that was very important that we took ownership of our patients, if only for the 3 years that we'd be training. I really think that was a critical component, I also think our procedure clinic is amazing. I really, in hindsight, appreciate our procedure clinic more than I thought I ever would. Your hands-on experience, by the time you leave, you really are comfortable with a lot of these procedures, and you'll meet peers as you get out of residency who still want that extra experience. They've probably done a procedure here or there or once in a while in the clinic, but in our procedure clinic, you're just getting to do this over and over, and you're getting really good at it. So you really do gain proficiency. So I've mentioned before Kasson. I think Kasson is amazing, right? Just the breadth of stuff that we can see is absolutely incredible at Kasson. I love the procedure clinic. Again, I loved our inpatient service. I especially appreciated the fact that we didn't rotate through an internal medicine service. We had our own inpatient service. And so all of the patients in Rochester who have a primary care physician as a family doc. So a family doc was their primary care physician, is the way to say that. If they need admission to the hospital, then they're admitted to the family medicine inpatient service. So I really enjoyed that because I really got to take that entire context, that picture, right, into account when caring for this patient. It's not just someone who just flew in, they're just here for care of XYZ and then they're gone. I really love that they were a part of the community. Their primary doctors were our preceptors. They were our mentors. So people we really could learn from, learning the way to provide the best care possible to our patients. So I think the inpatient service is certainly a highlight of our program. And then I think too, just the access to Mayo at large. I was the president of the Mayo Fellows Association. I think that also opened up so many avenues, so many doors for me. I learned so much about medicine on an administrative level through that program. And just by being in our residency, you have access to this machine, for lack of a better term, that is Mayo. But now that I'm out in the real world, I can say, honestly, there's something about the Mayo Clinic. Like, there really is. It's the number one hospital for a reason. And I genuinely think it is worth training here. It's worth training here. So I truly do feel like I was very, very well prepared for life as an attending. After coming from the Mayo residency program, I still have Dr. Angsman's number. I still call Dr. Gonzalez probably a little too often, but I love that they've remained mentors and they've remained really important parts of my life, even after I'm done with residency.